Yeah, okay. 나 혹시 몰라 경고하는데 잘 들어 지금 위험해 So dangerous 자꾸 나를 자극하지 마 나도 날 몰라 숨이 자꾸 멎는다 네가 날 향해 걸어온다 나를 보며 웃는다 너도 내 입에 끌리는지 눈앞이 다 캄캄해 네가 뚫어져라 쳐다볼 때 귓가에 가까워진 숨소리 날 미치게 만드는 너인 걸 아무도 널 못 보게 품에 감추고 싶어 우리는 시선들에 하나 일어나 거센 소용도 없니 그림자 내 안에 깨어나 널 보는 두분의
Can anyone help me? Thank you. Oh, what is emergency? Now we have to show the video to you guys. After you guys watch this video, do you guys have any idea about what is emergency? No. Steven, can you answer my question?
Cannot.
Why?
Because I don't know.
Okay.
Today night,
our topic is talk about how to dispose when emergency. And now let me cover the introduction part. The purpose of this topic is to guide you how to dispose when emergency. Emergency is a serious, unexpected, and often dangerous situation that requires immediate action. We must have some simple knowledge to solve the problem when we are in emergency condition. Example, cardiopulmonary resuscitation, CPR, shocking, medical cramps, minor bleeding, and spread. And now I would like to pass my time to Spong Xiaoming.
Thank you, my partner. It's the step of CPR. Let's enjoy this video.
Sudden cardiac arrests, SCA, have the potential to happen anywhere. This could be when you're walking down the street with grandpa, while at home, or at the workplace. Here's what to do if this happens when you are near. Step 1. Check for danger. Step 2. Check for response. Tap shoulders firmly and say, "Hello, hello, are you okay?" Step 3. If there's no response, shout for help. Shout, "Call ambulance 995 and get an AED." Step 4. Open airway. Head tilt chin lift method. One hand on forehead to tilt the head. 2 fingers of the other hand on side nearer to you to lift up chin. Step 5. Check for breathing. Look to see if chest rises. Listen to breathing sound and feel breaths on cheek. If only gasping or not breathing, start chest compressions. Step 6. Chest compressions. Locate the lowermost rib nearer to you and slide middle finger along the rib to the notch at the lowest end of the breastbone. Place index finger besides the middle finger and the heel of the other hand next to the index finger. Lock your elbows and with arms straightened, start 30 chest compressions at the rate of 100 per minute. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 15. 1 and 2 and 3 and 4 and 20. 1 and 2 and 3 and 4 and 25. 1 and 2 and 3 and 4 and 30. Allow chest to return to normal position after each compression. Perform 2 ventilations after every 30 chest compressions, maintaining the head tilt chin lift position, and use your thumb and index finger to pinch the nostrils closed. Take a quick breath and seal your mouth over the casualty's mouth and deliver 2 quick short breaths of 1 second each, taking in a breath in between. Release the nose after each breath. Then continue CPR. If an AED is brought to the casualty, continue CPR without interruption. Listen and follow the AED instructions. The AED may prompt you to stop CPR temporarily. Continue CPR until the paramedics take over from you.
Any question you want to ask?
This video is quite boring. I don't know what is CPR. Can you demonstrate it now?
Actually, you can search from the YouTube, or you want to anything you want to do lah. Any question?
No.
Okay. Now I will talking about my topic is CPR. The step of CPR first is check the airway by open the mouth. Second, if the mouth is not clear, press the breathing by looking just moving out and down. After that is put our ear near to their mouth and not to disturb their breathing. This is all my part. Now I will pass my time to my partner.
And next, feel for breathing by putting our hand on the lower part of their chest. If the person is unconscious and not breathing, we need to do the spit out. We need to place the heel of one hand in the center of their chest and other hand on top, compressing to 1/3 of their chest left by 30 times and give two breaths till their head back by little chin. Keep their nose closed, then blow breathing into the mouth. 5 deeply in 2 minutes until we hand over to the ambulance officer. And next, I will pass the time to my partner.
Okay.
Talk about what is choking. Choking is a major cause of respiratory emergencies and cardiac arrest in infants and children. Choking occurs when a foreign object such as food, buttons, coins, or toys are inhaled and partially or completely block the airway, preventing adequate breathing. In many cases of choking, particularly in adults, the individual actively coughs and is able to expel the foreign object with no assistance or medical attention. However, children and infants are at increased risk of choking and foreign body airway obstruction due to immature airway and dental anatomy disruption and plaque during eating, and a natural tendency to put objects into their mouths. A survey about the death of choking. Each year, more than 17,000 infants and children are treated in hospital emergency departments for choking-related incidents, and more than 80% of these occur in children aged 4 years and younger. Airway obstruction, death, and injury are especially prevalent in children under age 4 due to anatomy, which is small airway, natural curiosity, and tendency to put objects in their mouths, and incomplete chewing. According to statistics from the Centers for Disease Control and Prevention, choking rates in 2001 were highest in infants. Now, the step of choking. The first one, stand behind the person and wrap one arm around their chest. Firmly strike the person on the back between the shoulder blades 5 times, checking if the block catch has been removed after each block. If unsuccessful, we need to lean the person forward slightly and stand behind him or her. Make fist with one hand and place it thumb side in the center of the abdomen, which near the tops of the stomach, just below the center of the rib cage. Then grasp your fist with other hand. Give 5 abdominal thrusts by making a quick hard movement inward and upward 5 times. Keep giving 5 back blows and 5 abdominal thrusts until the object is coughed out.
Sorry. Wrong. Already. Muscle cramps. The step of muscle cramp is relax, calm down, and take a deep breath. Then gently massage the affected muscle. If the leg cramps, fully straightening the leg and bending over grabbing the end of the toys, then cramp will eventually relieve. A local analgesic cream or ointment as the muscle relief pain cream also can be applied over the muscle. In the same time, we can give green beverage containing potassium such as a salt containing drink to the patient. Thank you.
Then my part is the step of minor bleeding. First, sorry. Hello. 搞了吗？什么？我现在 presentation 啊，我在 present 啊。哦，等下出去玩啊？去哪里？去梦城？可以，等我，好像。OK。First is wash your hand to avoid infection. Use direct pressure to stop the bleeding. Use clear water to rinse the wound. Also clean around the wound with salt and a washcloth. Apply a thin layer of an antibiotic cream or ointment to help keep the surface moist, discourage infection and help the body natural healing process. Last is cover the wound by using the bandage to keep the wound clean and keep harmful bacteria out. Okay, now I pass my time to who?
Now I'm going to talk about sprain and cold. The step of sprain and cold. First, ask the patient to hold up on the table or on someplace sturdy where their foot can hang off by a few inches. Second, place the heels and leg pegs on the top and back side of the ankle. Third, move on to applying pre-wrap using bandage from the midfoot to the gastroachetes. Fourth, cover the foot entirely in order to prevent the tap from the sticky to the skin. Fifth, place 3 descending ankle straps at top of where begin applying the bandage.
Apply 3 semi-overlaps beginning of the medium size and lateral size. Then cross down the strips of tape that nearly cover the strips. Add 2 his loss. Begin at the body prostrations at the side of the ankle. Go under the foot. Bring it back out to the front of the ankle and then wrap it around the back. It should end where we started.
For my part, the conclusion. Timing could be the key to save someone's life in every emergency situation. When someone is unconscious, using a combination of chest compression and rescue breath to minimize potential injuries. Choking will cut off oxygen to the brain, so we need to have the basic of first aid for choking and CPR. Muscles, cramps, and spasms make the people annoying and it can cause major health issues in short amount of time. Most common cause of minor bleeding is an injury get emergency medical help for self-bleeding. Treatment for a sprained ankle may include rest, spikes, and exercise because ankle sprains are one of the most common sports injuries. Having a plan does not guarantee that nothing bad will happen, but having a plan gives us fighting chance against severe weather. Thank you.
你们觉得